Hi, I'm Adari P.T. Brown. As the healthcare debate comes to an end, so many of us wonder, how will it look? What will take place? And so many of us are pushing for a public option. But what no one seems to tell me, I support a public option as long as it's affordable, as long as it means we're not adding to our national debt. If someone can tell me how we can add a public option without adding to our national debt, then I'm all for it. But until somebody on the left or the right or in the middle show me a way that we can do that, then I cannot support a public option. I want a public option, but my fear is we're adding to our national debt, and simply adding to our national debt is passing the buck. It's passing the buck of who will pay for our nation years from now. We're passing it along to future generations of Americans, and that's not something I agree with. I have never agreed with adding to the national debt. The national debt is not a Democratic or Republican problem. It's an American problem, and we need to deal with it. So how do we deal with it, people? Simple. Show me a way that we can get a public option done without adding to our national debt, and I will support it. Show me a way, cut back the spending in Washington on some of these other programs that are ineffective, not successful, and are not producing results, and I will show you a way that our national debt can go down and we can pay for a public option. However, no one wants to talk about that. Everyone simply thinks healthcare reform has to have a public option in order for us to get it done. I refuse to believe that. Even with a public option, how will some Americans pay for it? Tennessee had a public option. I came from the state of Tennessee after 5 years there, and I saw how a governor said no more to TennCare and got rid of it because it wasn't, the cost was driving the state of Tennessee down a slippery slope that no one could sustain. In other states, they've tried a public option and it's still not as effective. Not everyone is covered, and the cost is greater than the results. So while everybody wants a public option, let's really think about it. How do we pay for it? Will it drive up the cost, and how much will it cost each and every American? Some people might benefit from a public option, but probably all Americans won't. Will it give everyone health care insurance, or will it force everyone to have health care insurance? What will happen? Those are questions we must ask ourselves. Right now, as the public health care debate comes to an end, my only fear is, will it add to the national debt? I've seen many versions of it without the public option. I believe that the national debt should be our priority. If we don't deal with it today, then when will we deal with it? I believe that we do need healthcare reform. We can't achieve that without a public option. CPR, we can get coverage, prevention, and reform in the terms of accessibility and affordability for most Americans without a public option. But so many people are so caught up in a public option that they do not understand, how can America afford a public option? Will it create a greater risk years from now? Will it add to the debt? Those are the questions we need to ask ourselves. I'm for healthcare reform, but I'm not sure the public option is the only way to achieve it. So if someone can explain it to me, I'm willing to support it even further. But right now, I know a public option would grant many more Americans healthcare than they have, but I also know that we can achieve healthcare reform and get more Americans healthcare without a public option as well. I'm Hadari P.T. Brown, and this is my perspective.